Hey everyone, and welcome back. We're diving deep into the world of athlete ECGs today.
Oh, yeah.
And we've got some awesome material for this one
Yeah.
from our friends over at London Heartbeat's Z Academy in the UK.
Very.
Cool.
Okay.
Big thanks to them for helping us unpack all this.
Absolutely.
And be sure to follow us on Facebook and YouTube to keep up with all our deep dives.
Yes.
So,
Looking forward to this one.
yeah, me too. Interpreting an athlete's ECG.
Right.
It's not as simple as you might think.
Yeah. It can be tricky, really.
So what's the big deal with these athlete ECGs? What makes them so different?
Well, for a long time, we used the same criteria for everyone, athletes and non-athletes alike.
Oh, wow.
And that led to so many false positives.
Wow, I bet.
You know, imagine being told you've got a heart problem when you're totally healthy
Yeah.
just because your heart's adapted to training.
Right, like a super athlete.
Exactly.
Yeah.
Yeah.
So how did we go from those early misinterpretations to a better understanding of athlete ECGs? How did we even get here?
Well, it's been a journey, like a constant evolution and refinement,
Yeah.
and a lot of the credit goes to the European Society of Cardiology, or ESC.
Okay.
Back in 2005, they came out with the first standardized criteria specifically for athletes.
Wow.
But, you know, even those had some limitations.
What kind of limitation?
Well, they were just a little too general.
Okay.
They didn't really account for all the unique adaptations you see in athletes' hearts.
Okay, so would you say they were?
It's like using a standard car manual to try and understand a high-performance race car engine.
Okay.
You're going to miss some crucial detail.
I love that.
Yeah.
Okay, so what happened next? Did they update the guidelines?
They did. In 2010, they rolled out a whole new model.
Okay.
And this time, they introduced this concept of training-related ECG patterns.
Okay, so finally recognizing that athletes are different.
Exactly. It was a big step forward because it acknowledged that certain changes, which might look alarming in a non-athlete,
Yeah.
were totally normal
Right.
for someone who's pushing their physical limits.
Right, like they're supposed to be different.
Exactly.
Okay.
But even with these updates, we were still seeing a ton of false positives.
Really?
Oh, yeah. Some studies showed rates as high as 60%.
60%?
Wow. So clearly there was more to this puzzle.
Okay, so who picked up the torch next?
Well, in 2013, a group of experts in Seattle developed the Seattle criteria,
Okay.
and they made a pretty groundbreaking discovery.
Okay.
The black athlete repolarization pattern.
That sounds pretty important.
It was huge.
What is that?
Well, you see, previous guidelines were mostly based on data from Caucasian athletes.
Oh, okay.
So that meant they often misclassified certain ECG findings in black athletes as abnormal.
Oh, wow.
The Seattle criteria recognized this critical gap, and they said, hey, these particular T-wave inversions in leads V1 to V4, they're actually common and totally benign in black athletes.
So finally recognizing that different populations can have different normal ECG patterns.
Absolutely. It was a game changer.
Especially for those athletes who were being flagged when their hearts were healthy.
Exactly. It prevented a lot of unnecessary stress and anxiety.
So the Seattle criteria addressed this crucial issue of racial differences.
Right.
But what about other ethnicities? Were they included too?
That's a great question. And while the Seattle criteria were a major leap forward,
Yeah.
further research is definitely needed to create equally nuanced criteria for all athletes.
Oh.
It's a complex field, and we're
Yeah.
constantly learning and evolving.
So it seems like every time we answer one question,
Right.
two more pop up.
You got it.
So where did things go from the Seattle criteria?
Well, the next step came in 2014 with the refined criteria.
Yeah.
And this introduced the concept of borderline ECG patterns.
Borderline.
Yeah. So think of it like this.
Okay.
One borderline finding might not be a big deal on its own,
Okay.
but if you see two or more together, then it's worth taking a closer look.
Okay. Can you give me an example?
Sure. Imagine an athlete with a slightly enlarged left atrium
Okay.
or a certain type of bundle branch block
Okay.
on their own. Not a big deal.
Yeah.
But together,
Yeah.
it could be a signal that something else is going on.
Okay. So adding more nuance.
Exactly.
So did the refined criteria become the gold standard?
Not quite.
Oh.
In 2017, we got the international criteria,
Okay.
which is the current standard we use today.
So the ultimate criteria.
You could say that. They combine the best of all the previous criteria with the latest research.
Wow. Okay. So we finally have the ultimate guidebook for athlete ECGs.
We're getting there.
But even with these highly refined criteria,
Yeah.
are there still areas where even experienced clinicians might misinterpret findings?
Absolutely. It's a specialized field, and errors can definitely happen, especially if the clinician isn't super familiar with the unique patterns we see
Yeah.
in athlete ECGs.
Okay.
Some common misinterpretations involve things like T-wave inversions,
Okay.
particularly in Black athletes,
Right.
or mistaking benign Q waves for something more serious.
Yeah, it sounds like there are a lot of little traps hidden within those lines.
There can be.
So experience and expertise are still super important
Absolutely.
for accurate interpretation.
Yeah.
Should all athletes be seeing sport cardiology specialists
Ideally,
for their ECG readings?
that would be the best case scenario, but realistically, that's not always feasible,
Yeah, I can imagine.
especially for athletes who might not have access to that kind of specialized care.
That makes sense.
Yeah.
Okay, so it seems like we've covered a lot of ground already,
We have.
but I feel like we're just scratching the surface.
Oh, there's more to come.
What else do we have in store for this deep dive?
Well, next we're going to delve into how factors like race, ethnicity, and even geographic origin can influence how we read an athlete's ECG.
Wow.
It's a fascinating area of research that's constantly evolving.
It's blowing my mind already. I can't wait to hear more.
Yeah.
But first, I want to remind everyone to subscribe to our Facebook and YouTube channels so you don't miss out on any of our deep dives.
Absolutely.
And a huge thanks again to London Heartbeat's D Academy for giving us the knowledge
Yeah, big shout out to them.
to break all this down.
For sure.
Now let's get back to the fascinating world of athlete ECGs.
Let's do it. So let's jump back into this fascinating world of athlete ECGs
Okay.
and delve a bit deeper into how race, ethnicity, and even geographic origin can impact our reading.
Okay.
Remember how we were talking about that Black athlete repolarization pattern?
Yeah, like we finally acknowledged that different populations can have different normal ECG patterns.
Exactly. That was a big step forward with the Seattle criteria.
Yeah.
Recognizing that those T-wave inversions we used to think were abnormal are often totally normal in Black athletes.
Right.
But then research started digging even deeper
Okay.
and kind of threw a wrench in things.
What do you mean?
A study by Writing and his team looked at a huge group of Black athletes, and they found that the prevalence of those benign T-wave inversions varied a lot based on their ancestry.
Oh, wow, really?
Yeah, so even within Black athletes, those normal patterns weren't so universal.
So you're telling me that even within Black athletes, those normal patterns weren't so universal after all?
You got it. It really highlighted the need for more specific criteria.
Wow.
Like Black athletes with Middle African roots, they had way more of those T-wave inversions compared to those with, say, West African or African American or Caribbean or even East African ancestry.
Wow, I had no idea that family history
It's incredible.
could have such a big impact on the ECG.
Absolutely, and it brings up a big question.
Yeah, what's that?
Do we need even more specific criteria that look not just at race, but at specific geographic origins?
Wow, that'll be really interesting.
It's complicated, but it's clear we need more research to create truly individualized guidelines.
Wow, the more we learn, the more we realize we don't know.
It's true.
It's kind of humbling
It is.
and exciting at the same time.
Absolutely.
Okay.
And here's another twist.
Okay.
That same repolarization pattern we see in Black athletes, the one with the J-point elevation and the T-wave inversions, can also pop up in non-Black athletes.
Really?
It's less common, but it can happen.
Interesting.
Keylor and his team did a study on this and found that this pattern was actually a good indicator of a healthy heart no matter the race.
So maybe what we thought was race-specific
Right.
is actually just a sign of an athlete's heart
Exactly.
adapting to training.
It seems that way.
Wow. That really highlights the complexity of these patterns and how much more research we need to figure out what's truly normal
Right.
and what could be a red flag.
You got it.
But it's not just race and ethnicity, right?
Right.
Age and sex also play a role in how we interpret athlete ECGs.
Absolutely, you're right.
Yeah.
We can't forget about those factors.
Okay.
So the current international criteria, they mainly focus on athletes between 12 and 35 years old.
Okay.
When we look at younger athletes, especially those under 12, we just need more data to know for sure if these criteria still apply.
So there are still some unknowns when it comes to those younger athletes.
Yeah, their hearts are still developing, and those changes can really impact how we read their ECGs.
That makes sense.
It's like trying to use an old map to navigate a city that's constantly under construction.
Yeah.
We need to keep updating our understanding.
What about older athletes?
question.
Those past their prime, so to speak.
Some research shows that the international criteria might work for masters athletes. Those over 35,
But
we need more studies to confirm that for sure.
okay, so we need a whole atlas of ECG patterns.
I like that.
With specific maps for all these different age groups.
Right. And just like we need age-specific maps,
Yeah.
we also need to think about sex-specific variations.
You mentioned earlier that female athletes
Yeah.
can have unique ECG patterns,
They can.
like those female endurance athletes.
Right.
I was reading that they often have more of those anterior T-wave inversions.
That's right. And while the international criteria do account for some sex differences,
Okay.
mainly in the QTC interval,
Okay.
we need more comprehensive sex-specific guidelines overall.
That makes sense.
Those anterior T-wave inversions in women,
Yeah.
they're usually nothing to worry about, just
Yeah.
a reflection of their training.
Okay.
But without clear guidelines, those findings can lead to unnecessary tests and anxiety.
So we need to dig deeper and understand those differences better.
We do.
Are there any other challenges?
Yeah, there are a few things to keep in mind. Like, some experts think that electrode placement might be affected by breast tissue in women,
Okay.
which could potentially skew the readings.
Wow. It's amazing how much detail matters
It is.
when we're talking about these ECGs.
Every little thing.
So it really highlights how much expertise is needed to interpret them.
For sure.
So we've talked about some of the challenges,
We have.
but what about the future?
Yeah.
Are there any promising research areas that could help us refine how we read athlete ECGs?
Absolutely. Researchers are exploring some really exciting avenues
Okay.
that could help us better distinguish those normal athletic adaptations
Right.
from signs of a true underlying heart disease.
Okay, awesome.
One area is this thing called low QRS voltage.
Low QRS voltage.
Okay.
Break that down for me.
So the QRS complex on an ECG
Okay.
represents the electrical activity that makes the ventricles contract.
Okay.
Those are the heart's main pumping chambers.
Right.
Low QRS voltage just means those complexes are smaller than expected. Now, this can happen for different reasons,
Yeah.
but in athletes, it can sometimes be a sign of conditions like ARVC.
ARVC, arrhythmogenic right ventricular cardiomyopathy.
Yes.
That's a serious condition that can cause sudden cardiac arrest.
That's right. It affects the muscle of the right ventricle.
Wow, scary stuff.
It is, and some research shows that low QRS voltage might help us differentiate
Yeah.
between benign ECG changes
Okay.
and those who have ARVC.
Okay, so it could be a warning sign
It could.
that something more serious is going on.
Potentially, but we need more data to say for sure.
Yeah, like we need to see the whole picture.
Exactly.
Okay, so we've got low QRS voltage.
Right.
Any other emerging ECG parameters?
Yes. Another one that's getting a lot of attention is QRS fragmentation.
QRS fragmentation. What's that all about?
So picture the QRS complexes on an ECG.
Okay, those spikes that show the ventricular contraction?
Right. Instead of being smooth, they look
Yeah.
kind of jagged or
Yeah.
notched.
Like there's a crack in them.
Exactly like that.
And is that bad?
Well, in the general population,
Yeah.
it can be associated with things like coronary artery disease or cardiomyopathies.
Okay, so should we be worried if we see this in an athlete?
Not necessarily. A study by Olatrol and his team actually found that this fragmentation was more common in healthy athletes than non-athletes,
Oh, wow.
especially in the lead that looks at the right ventricle.
Okay.
They think it might just be a sign of benign right ventricular remodeling.
Okay, so just a normal adaptation to training.
Right. But of course, we need more research to really understand
Yeah.
if certain types of fragmentation are more worrisome than others.
It seems like we're uncovering more and more layers of complexity with these athlete ECGs.
Absolutely.
Okay, so low QRS voltage QRS fragmentation. What else? What other exciting research is on the horizon?
Well, one area that's getting a lot of attention is the shape of premature ventricular contractions.
PVCs.
You got it.
Those extra heartbeats that can feel like a flutter or skipped beat.
Right, exactly.
Aren't those pretty common even in healthy people?
They are, but here's the thing.
Okay.
The current international criteria
Yeah.
only focus on the number of PVCs,
Okay.
not their shape.
Okay.
So they suggest further testing if an athlete has 2 or more PVCs
Great.
in a 10-second ECG.
Okay.
But research is suggesting that the shape of those PVCs
Yeah.
might be just as important as how many there are.
Wait, so a single weird-looking PVC
Yeah.
could be more concerning than a bunch of normal-looking ones?
You got it. Certain shapes based on those electrical signals
Yeah.
can actually point to a problem, even if there are only a few.
It's amazing how much information we can get
Right.
from the shape of those little blips on an ECG.
It is pretty incredible.
So we need to start considering PVC shape in our evaluation then.
Absolutely. Future guidelines will probably need to incorporate that PVC morphology.
Okay.
It's like upgrading from a blurry black and white photo
Yeah.
to a high definition color image. The more detail we can see, the better we understand what's going on.
Okay, so we've got the number of PVCs, the shape of them.
Right.
Anything else we need to pay attention to with these?
Well, one more detail that's gaining traction is
Right.
the shape of ST segment depressions.
ST segment depressions, remind me what those are again.
Sure. So the ST segment on an ECG
Yeah.
represents the time when the heart muscle is relaxing after a contraction,
Okay.
and a depression in the segment where
Yeah.
it dips below the baseline
Yeah.
can be a sign of problems like ischemia.
Oh, right, where the heart muscle isn't getting enough blood.
Exactly.
Yep.
The international criteria say any ST segment depression of 0.5 millimeters or more is abnormal.
But you're saying there's more to it than just how deep that dip is.
Right.
The shape also matters.
The shape might matter.
Okay.
Some experts believe that upsloping ST segment depressions,
Okay.
where the segment slopes upward toward the baseline,
Okay.
might be harmless in athletes.
Okay.
But those horizontal or downsloping depressions,
It could be a sign of something more serious.
So it's not just about whether there's a dip,
Right.
it's also about what that dip looks like.
You got it.
Wow, we really are becoming ECG detectives here.
Haha. That's a great way to put it.
Okay, so we've got low QRS, voltage QRS, fragmentation, PVC shape, with ST segment shape.
You got it.
What else? Anything else we're missing?
Well, one more practical challenge
Okay.
is this thing called beat-to-beat variation.
Beat-to-beat variation.
Yes.
Like, what is that?
So sometimes you'll see an abnormal finding on an ECG,
Okay.
like a T-wave inversion or a ST segment depression,
Right.
but it's not there in every single heartbeat.
So it comes and goes.
It's inconsistent.
Okay.
And the current international criteria don't really address this.
So they don't tell us how to handle those inconsistencies.
Right, exactly.
What if it's only in 1 or 2 beats? Or half the beats?
Exactly. It's a bit of a gray area.
So we need a more standardized approach to these situations.
Some experts think we should have a specific threshold.
Like a percentage of beats showing the abnormality to
Right.
decide if we need further investigation.
Makes sense, but it sounds like more research is needed there too.
Always.
Wow. It's so clear that athlete ECG interpretation is constantly evolving.
It really is.
We've learned so much about how race, ethnicity, age, and sex can influence interpretation.
We have.
And even got a glimpse into some exciting new research.
It's fascinating stuff.
It is.
Yeah.
So what's next on our journey? What else do we have in store for today's deep dive?
Well, let's shift gears a bit and talk about those future directions in athlete ECG interpretation in more detail.
Okay, I'm ready.
We'll dive deeper into those emerging parameters, and you'll see why they have the potential to revolutionize how we keep athletes safe.
I can't wait.
Yeah.
But before we do that, I want to remind everyone to check out our Facebook and YouTube
Yes.
for more deep dives like this one.
Absolutely.
And a huge shout out to London Heartbeat's Z Academy
Big thanks to them.
for providing all this awesome educational material.
Yes. Thank you.
Okay, back to those future directions.
Let's do it.
Yeah.
All right. So are you ready to delve deeper into those future directions?
Oh, absolutely. We've talked about all the challenges and nuances,
Yeah.
so I'm really excited to hear about those new research avenues.
Yeah. It's some pretty cutting edge stuff.
Okay.
So let's start with low QRS voltage.
Okay, yeah, that was a big one.
Right. It could be a sign of ARVC.
That's serious heart condition.
Yeah.
They can lead to sudden cardiac arrest.
Exactly. And if it turns out to be a reliable marker in athletes, it could really change how we approach screening.
It would be huge for early detection.
Absolutely. And potentially even prevention.
Wow, okay, so low QRS voltage is definitely one to watch.
For sure. What about QRS fragmentation?
Yeah, that one was interesting too.
It's more common in athletes.
Right.
But we're still figuring out if it's always benign.
Right, like are there certain types that are more concerning?
Exactly. That's what research is trying to determine.
And then there were those PVCs.
Ah, yes. The shape-shifting PVCs.
Yeah, right, where the shape matters more than the number.
You imagine being able to look at one PVC and say, hey, that one needs more investigation.
Even if there aren't a lot of them.
Exactly. It could be a game changer for early detection.
Wow, that's amazing.
Right. And then we have those ST segment depressions.
Yeah, and the different shapes.
If research confirms that the shape matters as much as the depth, it could add a whole new layer of nuance to our interpretations.
Right, like being able to distinguish between benign and concerning dips.
Absolutely. And then there's beat-to-beat variation.
Yeah, trying to figure out how to handle those inconsistencies.
Right. It's another area where more standardized guidelines would be helpful.
Seems like the future of athlete ECG interpretation
Yeah.
is all about personalization and precision.
You got it. We're moving from a one-size-fits-all approach
Wow.
to a more individualized assessment.
And hopefully that means we can keep more athletes safe.
Absolutely. That's the ultimate goal.
Well, this has been an absolutely incredible deep dive. We've covered so much ground today.
We have, from the evolution of the criteria to the challenges of interpretation, and even got a glimpse into the exciting future of this field.
It's been fascinating.
It has, and of course, none of this would be possible without the incredible work of London Heartbeat Z Academy.
Oh, absolutely. A huge thanks to them.
Yeah, for all their efforts in advancing this field.
And thank you to all our listeners for joining us.
Yeah, thanks for tuning in.
Don't forget to subscribe to our Facebook and YouTube channels
Absolutely.
for more deep dives like this one.
We'll see you next time.
Until then, stay curious, everyone.